So to understand carotenoids, we need to look at their function in the back of the eye and in the brain. So at the back of your eye, you've got what's known as your macula, and directly in front of it, you've got this pigment called macular pigment. Light comes in this way, so your macula, and it's protected by this pigment. And the function of the pigment is to protect the macula, obviously. But what we've discovered through the research in Waterford and Professor Nolan and his team is that people who develop age-related macular degeneration are deficient in this macular pigment. They don't have enough of it. So the hypothesis back in the day was, if we get more of this pigment back up into your eye, would it prevent age-related macular degeneration in this dry form? And that hypothesis was proved correct in 2015 in a study called the MO study. But then in 2016, there was another research program called the TILDA study in Ireland, and it came out of Trinity College University. And in that study, what they discovered was people that had this macular pigment in their eye had better cognition than people who didn't. And that was significant because they didn't know why, but they knew that having this pigment, this stuff in your eye, made your memory better than if you didn't have it in your eye. So after that discovery, they started to drill into that whole process. And what they then discovered was, if you have this pigment in your eye, you also have it in your brain. Now, later on, they went on to do more research with patients with Alzheimer's disease. And what they discovered with the patients with Alzheimer's disease was people who died of Alzheimer's, they didn't have any of the pigment in their eye, nor did they have it in their brain. So they were deficient. And this macular pigment is made up of only three things: lutein, mesozeaxanthin, and zeaxanthin. That's all that's in it, nothing else, just those three carotenoids. And those same carotenoids appear in the brain. If you have it in the eye, you have it in the brain. And we now have a device where we can measure your carotenoid levels in your body. It's called a life scanner. There's 700 carotenoids on the planet. There's 50 in your diet, but we absorb 20 into our serum and into our skin. But only 3 make their way to your eye and your brain, and they are lutein, mesozeaxanthin, and zeaxanthin. You don't have to remember those, but that's what they're called. So by scanning somebody's skin, we can measure the level of carotenoids in their skin, and there's a direct correlation between what's in your skin, your eye, and your brain. And by doing that, we can find out if people are deficient. And if they are deficient, they are then at risk of developing age-related macular degeneration or indeed Alzheimer's disease. And that's why we do it. We scan them with the light scan meter. Very simple device, easy to use. One little known fact is we're 12 times more likely to develop Alzheimer's disease living in Ireland or the UK than we are living in a country like Spain, a Mediterranean country. And the scientists have identified the reason for that is the carotenoid levels, the micronutrients that people get in those countries, like Spain or Italy or South Mediterranean countries. They get micronutrients in their diet from the Mediterranean diet, as we all know it. So the scientists have identified those key nutrients that's in the Mediterranean diet that they're getting down there that we're not getting enough of up here. And again, those micronutrients are called carotenoids: lutein, mesozeaxanthin, and zeaxanthin.